In today's video, I'm exposing why Part B is exploding when it comes to expense, and then what that means for you, your taxes, and the costs that you're paying out of your pocket for upcoming years. Stick around, I'll be back in just a second. Hey, so most people focus on Part A insolvency, and especially when they start talking about like 2036, Part A is going to be insolvent, it's going to go away, and Medicare is going to go away, and oh my gosh, what's going to happen when that happens? But the reality is, I'm going to read you a little bit of information, explain exactly what is causing these high increases in taxes, premiums, and your cost out of pocket to rise. It really reflects in the Part B portion of Medicare. What most people don't realize is that Medicare Part B has already become the largest source of spending in the program. So I'm going to explain exactly why that is. And unlike Part A, Part B doesn't rely on trust fund. It's funded, like we've talked about before, general tax revenues plus your Part B premium or Part D premium. The beneficiary's premium that you pay in for your Medicare is increasing. So there's no running out of money. Instead, the cost just keeps rising, and you and I are going to be paying for it for years to come if we don't see change. So how Part B is funded. So let's just quickly go over how Part B is funded. Pays for, and this covers like Part B outpatient services are going to cover anything outside of the hospital. So I've said this many times, but Part A is hospital, anything attached to the hospital like the nurse, food, the Jello, the oxygen, anything attached to the hospital is Part A. Anything that is outside of the hospital is Part B. So Medicare Part B, a specialist that comes in and works on your heart in the hospital. Part A is going to have a fee and cost, and then your Part B services, like a specialist is going to come in, crack your chest open and work on your heart. They bill through Part B services, and it has a deductible and 20%. So Part A has deductibles, Part B has deductibles, and there's 20% of the billable rate. So what happens in all of this? Well, we're seeing is that taxes continue to increase, and then also the Part B and Part D premiums continue to increase. So funded by a combination of general revenue is about 75% comes out of the general revenue. And then monthly premiums are going to pick up about 25% of the Part B services. Well, it goes back into the video I just shared earlier about the responsibility of the government to manage money well, balancing budgets. When they overspend the additional money, when they break a budget and they go over, they're pulling that money from a different fund or allocating legislation to resource money over to, in a sense, get this out of the red into the green. Reality is, if we had a government that managed the money well and there's a surplus, that additional money would go and stay in the general fund, and out of the general fund, 75% of that would come out to cover Part B services, and then the monthly premium that you and I one day will pay in, or you're paying in now, 25% of that. Now, we're going to get into age and how age accumulates a loss, and how it does a lot of things when it comes to people aging. Now that we see people 65 and older living longer, and how that's going to impact what Part B costs are. We're going to talk about that in just a few minutes. All right, so let's review real quick on how Part B works. Pays for outpatient care, doctor visits, labs, preventative screening falls under Part B. Again, Part A services is the hospital, Part B services is out of the hospital. So if you have a doctor coming into the hospital to work on you, they bill through Part B of Medicare. The hospital itself is anything attached to the hospital, or like the nurse, Jello, and things like that within the hospital. So it's funded by a combination of the general fund, which is typically 75%, and then 25% of that is made up by your premiums paid in, Part B premiums, Part D premiums. This means costs go up. Congress doesn't cut the program, they just charge more. So when I started in the Medicare space, the Part B premium was much lower. I remember back when it was like $80-something a month. Now we're up to well over $100 a month, and it continues to go up. The cost of a living adjustment is basically the government's way of saying, hey, there is, inflation that occurs of 4%. So if you think about general inflation of 4%, if you have $1 million and you draw 4% of it, that's 40 grand, and you draw Social Security, that $1 million should never really go down. You should be able to maintain your $1 million of investment, draw interest off of it, and inflation occurring, there should be an increase of about 8 or 9% of your money. So basically, inflation affects us by about 4%. Now, if there's an an increase in inflation. It can go up, but the average inflation is about 4%. Well, we don't see that with Medicare Part B spending and Medicare Part B expense to you. It's going up higher than that some years. So the reality is, as years go on, inflation occurs, Part B expense and your premium costs have gone up with that. And then I'm going to be back in just a second to explain how that really affects you, and then some steps you can take to help regulate Part B costs and things like that as well. Just to recap, in 2000, the standard Part B premium was $45.50 per month. In 2024, it was $174.70, and then 2025, and then 2026, we keep on seeing it go up and up. So what's driving the explosion in spending, and then what's increasing this? So what's causing this? More people, here's one of the major reasons, more people are aging into Medicare. So right now, the baby boomers, there's about 10, depends on who you ask, 10, 11, 12,000 baby boomers per day that are aging into Medicare. So this huge influx means they're pulling from the general fund and Part B premiums that are being paid in. So the Part B recipients that are already on Medicare, and then this huge influx, it's making a cause of inflation occur with Part B expenses like the Part B premium. The second thing, people are living longer and needing more outpatient services. The reality is, 20 years ago, the average age was 74. Like right now, the average age of a senior is going to be about 84 years of age. We're seeing, like my aunt is like mid-90s. Now she's got macular degeneration, you can't hardly see, but she's ultimately pretty healthy. She lives and still is independently living beside her daughter, and living in like a little RV. So she's got a small space, but I mean, she takes care of herself. She gets up, she can bathe herself, and she can do the essential livings, a normal ADL. So people are living longer. We're seeing people live in their 90s and up to 100 years of age, and the average age has increased by over a decade over the last 20 years. So that's driving costs. Medical inflation is real. Tests, equipment, and services cost more. So we do realize, for better quality of care and better medical equipment and what they could do 30 or 50 years ago, now, if you just think about in the last 100 years, the improvement in the 21st century in medical and what can be done. I mean, being able to take DNA, blood, and determine DNA 100 years ago didn't happen, but you can actually resume a body, take DNA from somebody else and determine who murdered somebody 100 years ago by DNA. That is amazing how DNA works. So because of those improvements, we're seeing increases in cost because equipment and the services and the people, the professions to be able to do the services have increased. Advances in medicine mean more expensive treatments are available. So the reality is, 100 years ago, if someone was diagnosed with chronic illness, they just lived with it. There wasn't a lot to do. They would change their diet a little bit, or they'd drink like castor oil or something like that. There would be a home remedy that somebody may apply. But the reality is they died early. Now we have medication and treatment to prolong the life of somebody that's chronically ill or critically ill. We take people that would typically die with cancer within 3 years, give them radiation and chemo, extend out their life for 10 or 20 or 30 years longer. Therefore, it's increasing the cost. So some of this is not based solely on politicians not allocating money and the government not allocating money. The reality is we're kind of getting and reaping what we've sowed. We want more. We want better health. We want better health outcomes. We want longer lives. We want to stick around for the grandbabies, to have great grandbabies. And because of that, it drives up cost up and to the right. So why is this crisis for taxpayers and seniors? I'm going to cover this in just a second as we wrap up. Why is this a crisis? What's really happening with Part B that's really kind of sad and broken, and it's reflecting also in your costs? Now, we can't control, because, you know, we're in a sense, the greed and lust of mankind is just to have more. So we want more life and longer life and things like that. That's going to raise the cost. But here's some realities of what's going on. Because Part B doesn't have a spending cap, there's no limit on how much can be drawn from the Treasury. So the more money is drawn, the more increase it has to occur. And then Part B premium, Part D premium, it has to pay back into the Treasury to pay out. So there's no spending caps. There's not like, hey, this is what we're going to cover, or here's how service is going to be done. Or, as we were talking about earlier, just caps on like standardized fees for things. I mean, just having a regulated cost matrix that says if anybody charges for an annual physical, here's the cost you're going to be paid out. Like Medicare standard fee for service. That means the taxpayer's burden keeps growing every year. Every year we see just stupid decisions, and it's like we make a decision and then don't think about the repercussions of that, therefore increases occur. And seniors, especially those on fixed incomes, face rising premiums with little warning. So what does that do? It creates risk because it creates fear and frustration and anxiety, which affects your health. And then you go back to the doctor, which again cycles through this whole process of ongoing care, which again takes money from the general fund and then it puts it back towards the ongoing care. And the reality is our system is broke. So it's a hidden cost crisis because it doesn't make headlines. There's no drastic depletion date. It's not like, hey, in 2036, insolvency is going to happen and Medicare is going to go away. Well, they're talking about Part A. Medicare is not going to go away if Part A happens insolvency. Again, Part B is paid by the general fund plus your premiums you pay in. But the reality is they're not talking about these hidden costs, a rising of costs. Now all of a sudden, they have a knee-jerk reaction and come in and go, hey, we're going to pass legislation and we're going to regulate and what doctors are doing and what health plans are doing. And I always say what they do is they make rules too tight and they don't have accountability. And reality is balanced budget would fix it. And then also just watching the fraud, waste, and abuse that is occurring and eliminating those. If they just focused on those two things, it would reduce. So it's a draining on the federal budget, threatening long-term sustainability and putting a squeeze on seniors. So what can be done? So what could really help? And what can be done? Modernizing payment systems to reduce overbilling, as we've been talking about, just modernizing systems and reduce the overbilling, just standardized billing processes. Promoting value-based care instead of fee-for-service. Value-based care is, hey, we're going to pay you more if, in fact, the outcome of this person is a healthier life. So if you're measured in risk of assessment and they lower the risk, the adjustment of that, the doctor or the specialist or the hospital is paid back based on a value-based care. Again, to me, that's not going to work because it's not worked in the Medicare Advantage space. The regulation of just standardized fees is one of the easiest ways. Reevaluating Medicare Advantage payments to ensure accuracy. Again, overpayment. Money's going out for what? Making sure the money is accountable. Somebody doing checks and balances. Again, it goes back to the personal finances that we have to resume responsibility for our own homes and family. If I run out of money, guess whose fault that is? My fault. I run out of money, I can't go over to the government bucket and pull money over into my pile or my bank account. Controlling drug prices, especially those billed under Part B. Again, this is regulation right now that's going into effect as of 2025. It's going to push forward in 2026. Health plans and the government are getting involved in regulating the cost of what prescription drug plan Part D costs are going to be. If we ignore this part of the problem, even the best fixes to Part A will miss the bigger threat, which is Part B. Guys, my encouragement to you is staying involved. And then the reality of this is because most people are not going to do anything, the rising of cost is going to change your Medicare Advantage coverages, your Medicare supplement premiums, your Part D coverages and benefits and co-pays and costs like that. What I would encourage you to do is to make sure that you're working with a licensed agent or agency like us to just say, hey, what's going on and what can I do? And then am I still on the best plan allocated for my coverage and benefits? And then just being up to date on what Part B costs and premium changes have occurred, so you're aware of what's going on and where the money is going. And then other things about Medicare, getting an agency that can help guide you through this process and ensuring you're on the right plan is essential. Guys, until next time, I'll talk to you then.